Hi, Chris.
Hi.
Thank you for being here.
Thank you so much for having me. It's my pleasure.
So lucky to have run into you here at the Ultimate Wellness event. From the little bit that I was able to speak with you, it seems like there's a lot of wisdom that viewers need to hear, and we're here for it. Can you tell us a little bit about what it is that you do?
So my wife, Emily Rowe, and I have an integrated medical center over here on Miami Beach called Miami Beach Comprehensive Wellness Center. We're a full scope integrated medicine practice, everything from all of the Eastern therapies that my wife does, Chinese medicine, acupuncture, herbs, etc., to full scope of functional medicine, which includes comprehensive, advanced laboratory evaluations, dietary monitoring, and supplement use, as well as IV therapies, PRP therapies, ozone therapies, stem cell therapies, all of the whole gamut. And we combine that also with a deep knowledge of energetic medicine and different practices of sound healing, shamanism. So we really try to take all of these approaches and hold multiple paradigms in our mind at the same time and use those to help people navigate their health, whether it's for like wellness optimization and longevity, which we do a good bit of, and or if it's for chronic medical illness, like autoimmune diseases, chronic pain, chronic fatigue, even the run like hypertension, diabetes, all those sort of things. So that's pretty much a summary of how we do it.
Wow, that's incredible. And can you tell me about maybe what has been one of the biggest transformations that you've seen someone make in coming to you and and having the chronic disease, and then after working with you?
Man. Well, you heard about Emily.
Yes,
she was
I did.
Patient number one who got into
Mind-blowing.
this field because we couldn't find anyone to help her. So we went back to school and literally, like she said, we took all these classes together, literally hundreds and hundreds and hundreds of hours of study to learn these different techniques, and adding felt like every 6 months we were adding a new technique. But I mean, we've been very fortunate that this work has really paid off for so many of our patients. We really learn a lot from the experience of our patients. And they come to us seeking help because we always joke that we're like the 20th consult. Like they've been to 20 other doctors and I'm not getting better. And that's part of how I got into this, because I was in academic medicine. I was at a tertiary care referral center, University of Miami, and I would see patients go on this medical merry-go-round, provider to provider, the best of the best specialist in this, best specialist, sometimes flying all over the country. And they'd get a new diagnosis, maybe they'd get a new pill, they'd get a new study. Oh, now you need this fancy new surgery or something, but not getting well. So I knew that there had to be a better way. And that, along with Emily's and my own experience with things like chronic fatigue and heavy metal toxicity and chronic Epstein-Barr, all the things and mold toxicity, all the things.
You as well.
Me too. I was fortunate. I didn't quite have it to the severity that Emily did. I was very fortunate that I didn't develop an autoimmune disease. I didn't develop cancer, but I certainly was not well. I was also a much different looking person. I used to weigh about 240 pounds, and not in a healthy way. I was not jacked. I was very, very overweight, very tired, fatigued. I'd sleep 13, 14 hours at a time and wake up more tired than when I went to bed. Horrible acid reflux, like all these things. So through a similar process, learned all these things, food allergies and sensitivities, heavy metal toxicity, and I treated all those things, and the weight was almost a side effect. It was like I started feeling better, everything got better, and the weight just came right off. It's not like I put myself on a weight loss program. It's just I treated all of my own underlying problems. But I mean, I could tell you other stories about patients we've seen with things like lupus, autoimmune thyroid disease. We had a very impressive patient who came in with something called optic neuritis, which is a form of multiple sclerosis, which is an autoimmune disease of the nervous system. And we diagnosed her similarly with mold toxicity, heavy metals, and Lyme and other chronic infections. When she first came to us, I mean, she was losing her sight. She had cognitive impairment so bad that her husband and her mother had to give her history. And this woman was highly educated, doctoral degree. smart, and her memory and ability to relate her history was basically gone.
Oh, yeah.
She came and did extensive change in her diet, extensive supplement regimen, lifestyle change, got out of a moldy environment. That's a huge one. If you're getting exposed to mold, you have to be out of the moldy environment or you also won't get better.
Yes.
And she did ozone, a lot of ozone therapy. And now she's back to work, doing what she loves, helping people. And now I see her just for check-ins like once every 6 months. And she's doing great.
That's
And
incredible.
people are shocked. Like those are the sort of diagnoses where people get told this only gets worse.
Yeah.
You know,
It's almost like a death sentence for a lot of them.
a lot of people that this only gets worse. But the difference with this patient is that she made a decision that no, like I don't want to get worse. I want to get better.
Mm-hmm.
So that change, that mindset, and her ability to actually adhere to the regimens is what makes the difference. Because I can't stress this enough. Is that we help guide people. We provide treatments. We provide care. We do all sorts of fancy things. But if the person isn't an active participant in their health, it doesn't work.
Yeah, and I know that sometimes I've had nothing as severe as this, but I've definitely had something where like no one could help me. And what can happen in that process, especially if you're already not as strong-minded, is that so many people tell you like this is the end, it's not going to work, you're not going to get better, it's going to be worse, you're not going to be able to move, you're not going to be able to do this. That it's hard to have that willpower because it's at the you get to you, but it's like you know, like is it really going to get better? Is this just another doctor saying this?
Yeah.
So it is, you know, that will to say no, I'm going to get through this no matter what.
And sometimes they'll come to us and, like I said, consult number 20, here we are, and we'll tell them, hey, you've got this chronic Lyme infection, and there's so much controversy out there about it, or mold toxic, any of these things we talk about.
Yes.
You know, in the conventional world, people are either apathetic, like they don't think it's a thing, or they're actually, you know, incredibly antagonistic, and they'll tell you that's not a thing. Like mold doesn't make you sick like that. It can give you allergies, but it won't make you sick like that. Oh, everybody has mercury in their blood. It's not going to hurt you. Like it's normal. Like, well, it's not normal that we've all been poisoned. And some people, it affects them very severely. And those are the ones who need the more intensive therapies. So sometimes when they come to us, it's a bit of a shock. Like, and the very common thing I hear is, why didn't my other doctors test me for this?
Yeah.
Why didn't they look? And I don't think it's because they're badly intentioned. We're not taught these things.
We're
Like
not.
as physicians, we don't learn this medicine unless you take the initiative to go back to school and you learn them yourself, like through places like Institute for Functional Medicine, ACAM, American Center for Advanced Medicine, ILADS, you know, ICI, all these different organizations that we're members of and we work with, and we have this community of like-minded physicians. It's really funny too, in those groups, it's like nothing's a secret. Like everybody wants to share. Like what our favorite, like our mentors, people like Dr. Neil Nathan, Richard Horowitz, you know, Joe Barascano, all these guys, they want to share. Like they want other doctors to learn. But the trouble is getting it out there and then actually having people, you know, do the treatments that are required to treat these things and address them.
Wow, that's incredible. It's good that you have those mentors, and it's good that you've been through it yourself as well, because you know what words to say to some of these people that are, you know, that are suffering or going through it. It's not like your doctor's never experienced it, and you're just trying to help someone. It's like you can say it from experience.
Yeah, like it goes a long way, and I find too when we talk to our other colleagues that do this work, everybody's got a story. Exactly. Either it was me that was sick, or my spouse, or my child, or a relative. You know, someone they knew wasn't getting better in the conventional world, because all of us came from that world. Like I respect the education I received. You know, I'm a board certified OBGYN. I'm still board certified, and like I still do. You know, if you need a Pap smear, I can do that too. Like there's nothing wrong with that. And there's a place for conventional medicine. You know, if you call me up and you say, hey, Chris, I'm having crushing chest pain and my arm feels funny and I just passed out. I'm like, it sounds like you're having a heart attack, man. You better go to the ER.
Yeah.
Like, don't come, like, now's not the time for me. I'm like, you go to the ER, let those guys save your life, and then you can come to me and we'll talk about, well, what am I going to do to help your heart heal after that heart attack or whatever. So there's a role for modern medicine. It's very good at treating acute, life-threatening problems. The trick is, well, what do we do so we don't need that?
Yeah.
And that's what the wellness and longevity is all about, is like, well, what sort of things might I be at risk for in my lifetime? Like, do I have a bad family history of cancer? Bad history of heart disease and diabetes or whatever. And what can I do for you when you don't have any of those things yet, to prevent you from developing them, so that you're never going to need those sort of services, or you're never going to need those medications.
And that's the key, prevention, right?
Very much.
And not have to go through the illness and then try to reverse. So yeah, prevention is definitely key. And how much would you say mindset and spirituality play into getting better?
It's funny. It's like, it's a lot. It's a lot. Mindset, especially about how you view your progress through this. There's kind of this idea that when you go to a physician, you're going to get a prescription of something that's then going to fix your problem. But even in that simple model, you still have to put the pill in your mouth. So there's still, you got to do something. But also understanding that addressing how you see your health and how you see your purpose in life is super important. I find that the people who do best have a strong purpose. If they have a strong purpose, and you can see it on their face, and they have a whatever that might be. Yes. For some people, it's their career. For some people, it's their family. For some people, they're passionate artists. Whatever that purpose is, when they have that purpose, that's everything.
Absolutely.
Having that alone isn't quite enough. Like, we got to fix what else is here. Like, we can't just live in that beautiful etheric space. Like, we have a physical body, we have to fix too. So it's a key bit, and getting in touch with your spirituality, whatever that is, it's been a very important for my healing journey too. And identifying for me and cultivating that part of my life has been a very, very important journey. Not only just with my own practices, but experiences with shamanic techniques, plant medicines, and experiences along those lines have been very powerful for me. I used to suffer a lot from depression, but I took antidepressants for years, over a decade. But I came off of them with the help of my wonderful wife, and acupuncture and herbs and different sort of treatments along those lines. And I also did a lot of therapy and EMDR. I don't know if anyone today has talked about EMDR.
No, I've done it
myself.
It's great. It's powerful.
Wow, it's great. It helped me a lot. But a major turning point for me was actually ayahuasca ceremony.
That's one on my list.
If it calls to you, it's very powerful.
Yeah.
If it calls to you, it's a very powerful tool. And the shaman that I worked with in Peru, like, really, really helped me and ayahuasca, Mother Ayahuasca, helped me, grandmother, to clear a lot of grief and guilt and other negative feelings that I'd been holding for a long time. And the purge is irresistible. So I say, for people who are in the right space, those sort of medicines are very useful. And there's other ones you can do that are local, like things like ketamine. I mean, ketamine therapy is another wonderful way to do psychedelic medicine that's very useful for people who have had trauma, depression, anxiety, addictions. And that's a little more accessible to people. And I encourage people, if they're called to these medicines, to look into it, make sure that they're doing it the right mindset, the right people, in the right setting with the right folks.
That makes sense. Oh my goodness, this has been so informational. I'm definitely going to catch up with you more after this and stop by your booth. It's been incredible and such a treat to have you both at the Ultimate
Thank you.
Wellness event. This has been great. And Embody, I'm hoping for some collaborations in the future.
Well, it's our honor. It's an honor and a privilege to be here, and thank you so much for having us.
Yeah, thank you, Chris and Emily, who's off camera right now. But thank you both.
Thank you. Appreciate you.